Hi, this is Vaughn. Today's topic, shin splints. A condition that's often presented to massage therapists. What are some great ways to address shin splints, resolve them, and do it by utilizing instrument-assisted soft tissue mobilization? Now, the great thing about instruments is that you can be very precise with your treatment application. You can be good with your hands, but you can extend the technique of your hands through a well-designed instrument. With shin splints, our primary concern is with the tibialis posterior muscle. That tibialis posterior muscle is both a plantar flexor as well as an ankle inverter. It runs along the anterior medial side of the lower leg, and it is typically the irritation of this muscle that brings people in reporting of shin pain. A great way to address that is to ensure that you lengthen the fascial tissue, the skin, and the tibialis posterior muscle itself. So we'll use the instrument-assisted work while putting the tibialis posterior muscle into a mild lengthening position. And I do that by simply taking the foot, everting it, and slightly dorsiflexing it. Now I'll take the instrument and at a 45-50 degree angle, I'll just start moving proximal to distal along the route of the location of the tibialis posterior. And just moving down to this area. Now, as I move down to the area, we start to look at where the tibialis posterior is attached. So the medial cuneiform bone and the navicular bone that can be found at the high point of the longitudinal arch. So putting the tibialis posterior into a position of slight stretch tension, I'll take the instrument and I will use the broad side to simply create a nice tissue release right at the attachment found here along the longitudinal arch of the foot. The entire time I'm holding that muscle in length tension by dorsiflexing and everting while using the instrument to create the nice fascial release. The great thing about this application is that with the tool, I can get very specific about my pressure application, much more so than I can if I was simply using the pad of my finger or even a thumb. And by replacing the pad of my finger contact or my thumb contact with an instrument, I have much more control over angle, pressure, and glide speed when I need to be very, very specific. To get good results with resolving and reducing shin-related pain and discomfort due to function and activity, using an instrument is a terrific extension of the sensitivity of your hands with much more specific application control. Get yourself some HawkGrips.